Hello, my name is Ruth Sedgwick. I am head of RCSLT's Northern Ireland office, and it's lovely to have a few minutes to share with you a little bit about our work and what we do. So there's three of us that work in the Northern Ireland office. There's myself, Janet McGuckin, who's our executive assistant, been there 16 years. She is fantastic, and if you ever come to one of our events, you will meet her. And then recently this summer, Sue McBride joined us as our policy advisor. So just the three of us, but I hope that whether you have heard me before at maybe one of your student induction days, or if this is the first time that you're seeing me, that by the end of this, you will know that you can just pick up the phone or email me or any of us anytime, and we will do our best to help you. That's what we're here for. In Northern Ireland, we have about 800 members-ish, hopefully maybe a few more after today. And we are here for our members. We have the hub, which is a great way to get involved. We have a few student members on our Northern Ireland hub. It's a great way to meet SLTs, prospective employers as well, and prospective peers and colleagues. A great way to see what's happening out there on the ground, get involved in RCSLT working groups, listening to and seeing what the processes are like for reviewing guidance and writing new guidance. It's really, really a very, very useful resource and a useful thing to do, excuse me, to get involved with your professional body. It looks great on your CV. So just saying. I'm an SLT by background as well. I worked clinically up until 2 years ago when I took on this post, and I spent my last 9 years specialising in dementia and mental health. And I qualified from Ulster University in 2005, so 18 years ago now. So a few things about what we do. Like the other offices and the other departments and all of our RCSLT, we are here to raise the profile of the profession. We are here to lobby to decision makers about the importance of speech and language therapists, why you need them when you're working with children, why you need them for adults, whether it be mental health, cancer, stroke, children with profound needs, those in the justice system, those in looked after care. There are 35, maybe, don't quote me on it, clinical areas. There are so many ways that speech and language therapy can have an incredible impact. And we are there to showcase that, to tell people, to tell those that have the purse strings, you need more SLTs and here is why. And we use our members for that at times. We'll come to you, we'll have members share their stories, we'll have service users and patients that have had speech and language therapy talk about that, and we might get the media involved at times as well to showcase some of the amazing work that's been going on. The story and the voice of the service user and of the SLT is really, really powerful, much more powerful than my voice will be. So we're talking to decision makers. We also get involved in some really good projects as well. And one of them that I hope you'll hear about coming soon in 2024 is called Buddy Chat. And Buddy Chat is a video-based resource that we are creating lessons that teachers can literally press play on that teach children aged P3, 4 and 5 all about speech, language and communication needs, about what it looks like when a child has some difficulties. We're covering stammering, speech sound disorder, ASD. So lots of six areas covered, I was going to say lots, but 6 covered of the main ones. And we will be launching that come February. So really, really good. Fits into the curriculum, all about anti-bullying, inclusion and accessibility. And I think it's absolutely fantastic to be able to work on something that really has the power to impact the lives of those living with speech, language and communication needs in our schools, such as a wee snippet of some of the things that we do. Another thing that we're working on now is our early language. We want to raise the profile. We want to collect, and we're collecting data, so we're asking people about their experiences as an early years provider. What is your experience of children between 0 and 5, their communication needs? Have they increased since COVID? We think that they have, but we don't have the data. So we're gathering data and we're working with key stakeholders, Department of Education, the Education Authority, the Public Health Agency, childminders, Bernardo's, Sure Start, key speech and language therapists coming in to help us. The university is involved as well in how do we write recommendations that actually are meaningful, that we can then work with others, collaborate, and then say to our government, well, first of all, we really want a functioning government, but even at that, we're still working really hard behind the scenes to get ready for when we do, to be able to say, this is what we need. We need funding for our early years. We need support. We're falling behind the other nations. And here's the evidence. So that's just a little snippet of some of the things that we do. I would just say, please do get involved. And if you have any queries, please just fire me an email. Thank you.